My name is Dr. Jeffrey King. I'm a board certified orthopedic hand surgeon. I'd like to talk to you today a little bit about carpal tunnel syndrome. Carpal tunnel syndrome is one of the most common causes of numbness and tingling in people's hands, and it typically involves these three fingers. Generally, the small finger is not involved. The classic symptoms are numbness and tingling, although some people complain of aching, coldness, soreness, or pain, although those are not the hallmark symptoms of numbness and tingling. This numbness and tingling can be intermittent, it can come and go, or it can be constant and be there all the time. A common problem is numbness and tingling at night, waking people up from sleep. Other things that can cause your symptoms to be worse include driving, talking on the phone, reading a newspaper or magazine, or any object that requires holding on to something which is vibrating, like a lawnmower or a vacuum cleaner or something like that. How do we make the diagnosis of carpal tunnel syndrome? Well, many people have already had a nerve study or perhaps even an ultrasound that says you have carpal tunnel, and that can be very helpful, although that's not the entire picture. When we see you, we would want to learn a little bit about your history. So when did your symptoms start? How did they start? How are they bothering you now? What things are making you better and worse? And generally, how is it affecting your life at this point? The second part of the diagnosis is physical examination. So an examination of your hand, looking at different areas and kind of performing different tests to see how your body is reacting to the nerve pressure at your wrist. Finally, we look at the nerve study or the ultrasound or any other associated information, and based on your history, your physical examination, and a review of these tests, we would decide if carpal tunnel syndrome was the right diagnosis. Now, what are the other diagnoses? Numbness and tingling can come from your neck, or there are other systemic diseases and problems that can be considered, although all of those only represent a fairly small percentage of patients with numbness and tingling. Okay, so we've made the diagnosis of carpal tunnel syndrome. What are the treatment options? Well, the first option you may have already tried, and that's using some type of wrist splint. This is generally something you can pick up at any store, and it's a Velcro or plastic splint that has a strut, some sort of firm piece right here, and then holds on with Velcro. And the purpose of that splint is to keep you from bending your wrist back and forth. It can be used during the day, during things that bother you, or it can often be most helpful at night. The other issue could be changing your activities. So if you can avoid doing the things that make your symptoms worse, along with wearing the splint, and that provides you with adequate relief, that may be all you need to do at this point. The second option is you could try a steroid injection. With a steroid injection, we take a very small needle and we inject medicine right here into your palm. Medicine is local anesthetic, which makes your fingers a little bit numb for a few hours, and then a steroid, which usually takes 2 or 3 days to work. And the purpose of the steroid is to shrink the swelling in your wrist and see if it makes your numbness and tingling go away. Now, that's something that can be done in the doctor's office. You go home the same day, but it has a long-term cure rate of about 50%. So about 50% of people get better and the symptoms don't come back. The other 50% of people may get significant improvement, but the symptoms could come back again weeks or months or even years later. And a small percentage of people, if you try a steroid injection, won't see any improvement at all, and that may be a useful test to determine that they are part of that small group of people with numbness and tingling, which is not caused by carpal tunnel syndrome. And that's a very useful thing to know before you would consider heading down the path to surgery. The final treatment option for carpal tunnel is surgical management, and many people know other people that have had carpal tunnel surgery, and it's a very effective treatment. The success rate is 95%, so it can work very well. And that's certainly something that you can discuss with your doctor if that diagnosis has been made. There's really not much evidence that taking any kind of pills or applying any ointments or surface treatments to your palm or that formal physical therapy or occupational therapy make any significant difference in altering the course of the treatment. So there you have it. That's a review of carpal tunnel syndrome. Hope you find that helpful. And if you have any further questions, please feel free to contact my office or your local hand surgeon.